All right. Well, we're going to go ahead and get started now. Welcome, everybody. Appreciate your time to spend a little bit here with us to hear about our pipeline to profit and looking at what we call a data-driven blueprint for practice success. With me today, I've got our friends from Reflexion Digital, Boost Patience, and then myself from Dextara Datamatics, along with a guest appearance from our friend Dan Wilson at ClearSight LASIK. So we're going to go ahead and jump in. Let me talk a little bit about our agenda today. We'll kick it off here with some introductions, and then from there we'll let Reflection give a bit of an overview on their services. I'll provide a bit of an overview on our services from Dextera, and then likewise from Boost Patients. And then we'll jump in kind of the heart of the webinar and using ClearSight LASIK as a case study to kind of showcase our work that we have collectively done for Dan and ClearSight. And then we'll close that out with some time for Q&A. So, if you have any questions as we go along, please post those for us, and we'll hit those at the end of our webinar. So, from an introduction standpoint here, we've got myself. I'm Vice President of Customer Success from Dextara Datamatics. Guys, Liam, you want to introduce yourself real quick?
Yeah, I'm Liam from Boost Patients. I'm the director of operations over there.
Perfect. And Cade, also with Boost, can't join us today, but we see him there. Aman, would you like to introduce yourself?
Yes, my name is Aman. I am the co-founder CEO of Reflexion Digital.
Perfect. RJ?
Yep, Robert Bernal, creative director and also co-founder of Reflexion Digital.
Awesome. And Dan, how about yourself?
I'm the CEO of ClearSight LASIK and Lens in Oklahoma City and Plano, Texas, and been doing this with these guys for a long time and in the industry for a long time.
Perfect. Thanks, guys. All right. RJ, I believe you're going to kick things
I'll
off
take
here
it.
for us.
Yeah, thank
Are
you,
you going to take
Garrett.
it, Aman? Okay.
Yeah. So awesome, guys. Thank you, guys. First of all, thank you, Garrett, for having us on here. So I'll give a quick overview for Reflexion Digital. We are a social media patient acquisition company, specifically in ophthalmology. These are 2024 numbers. We created about 3,000 short form videos, generated about 79,000 leads, and spent $1.7 million on social media ads. This year, we're looking to touch about $3.2 million just in social media advertising. So a question that we get asked a lot is, why social media? Why is that your number one patient acquisition channel? In the history of ophthalmology, the primary source of patient acquisition has always been either radio, television, Google. So why social media now? Well, the data shows that 73% of Americans are active on social media. On average, people use 7 different social media platforms. 83% of US adults are using YouTube, 68% use Facebook, 47% use Instagram. And specifically for the refractive space, 18 to 35 age group is making 70% of all TikTok users. And the average social media user is spending 2 hours and 24 minutes per day bouncing from app to app. And these numbers are only going up. So I think the proof is in the pudding that social media will always be a major factor where top of the funnel awareness will be. And it's going to only grow from here as the younger audience will, get older and older. All they're going to do is switch from one platform to another because this is where all the attention units are. So why hasn't social media worked in the ophthalmology industry? Well, if you see on the left over here, when we came in this industry, we used to see a lot of statics, graphics, on the left-hand side. On the right, we see, horizontal content, which is basically a TV commercial style content. So when you're going to post this content that's not seamless to your platforms. Facebook has a very specific type of content it's looking for. Instagram has a very specific type of content it's looking for. YouTube has a very specific type of content it's looking for. And specifically, everything changed after the TikTok algorithm kicked off, which is your vertical content, short form vertical content is what we call it. That has completely changed the game in terms of what content is working on social media. And if you post statics and if you put horizontal videos, you're really not going to get the results you're looking for because it's not native to the platform itself. So here's what we've seen work. We always test out multiple different styles of content specifically. The more content that you produce within your practice and the more variation you have, the easier it is for a patient to trust you, build credibility, get educated, all of that prior to them coming in. So on the left-hand side we have here is user-generated content. This content style works extremely well, one, because it's from a user perspective. It shows that, you're not really trying to sell your audience. You're just trying to give a perspective from what the patient is feeling like. Number two is your point of view from when you walk in a consultation. What does that experience look like prior to coming in? So if you can show that on your social media platforms, then as a patient, I would feel way more comfortable coming in, knowing what my consultation process looks like. On after that, you have a point of view procedure. A lot of times when you're dealing with eyes, there's a fear aspect. So showing your procedures, is in action specifically, it takes that fear element out. And on the right hand side, you have trends. Social media is an ever changing, fast environment where trends are constantly, there's new trends every month coming in. If you keep following trends, the algorithm actually uses that and picks up, basically gives you a reach, and you have something what we call a viral effect that's possible. This is one key strategy. I feel like social media is such a deep dive topic to discuss. But if we would have you to take away one thing from how to create content, it would be the hook strategy. So it's video and audio hook, which is the first 3 seconds of your video. The most important part of your videos and the content that you create is your first 3 seconds. And the reason why I say that, because 80% of all of your audience will not go past the first 3 seconds. So make sure that you have very strong visual and audio hooks. If you want to grab a specific, or you want to promote a specific procedure, for example, an ICL, you can say, hey, if you heard about a LASIK alternative, so you can be very, very specific and very direct with how you go about your hooks. And even with visual backgrounds, there's multiple different visual backgrounds that you can test out. And as we go further in the case study, we'll show you how we've been able to differentiate between video and audio hooks. But make sure you target your pain point and you're very, very disruptive in the first 3 seconds of your videos, because social media, there's a lot of volume of content being posted. You want to make sure your content is disrupted and it immediately caters to your specific pain points. So the way we look at it is your first 2 seconds is your hook, then it's your benefits, it's credibility, and then your call to action. This is a very simple flow that you can use to create content. And when you create this type of content, you're automatically going to see more views, more comments, more leads coming in.
Awesome. Thank you, Aman. I'll pick it up now. Brief overview on Dextara Datamatics. We are a Salesforce consulting organization, and we exclusively focus on Salesforce. We actually are what's called a summit level partner, kind of the equivalent of platform or platinum, excuse me. And so, which is kind of the highest tier and the top 1% of all Salesforce partners out there. As you can see, we've got a breadth of experience and consultants. We've got 150 folks, more than 150 folks worldwide. And we also cover a pretty broad industry focus, but healthcare being one of ours specifically. And let me kind of jump into that. So we've actually built a specific purpose-built solution for the healthcare space. and we call that DX Health. And here you can see the different pieces that we have included with that. First and foremost, and kind of where we're at today, is around this increased revenue part, which think of that in terms of more of around lead management. Okay, that's kind of the core and heart of what we're trying to do here, and you'll see a bit of that today. But the idea is having a centralized place for all of your leads to funnel into and to be tracked and worked and have the analytics that's associated with that. The next piece, kind of working our way clockwise, is around patient management and having what we call a 360-degree view of that patient from not only their core demographic information, but around their appointments, around their sales opportunities, around their communications that you've had with them, be it, say, email or SMS or voice and whatnot. So being able to have that, again, kind of that 360 view of the patient. We also offer a place to manage and track your referrals that you get from ODs and other doctors. We have that built into the system. EHR integration, that's included as well, being able to tie Salesforce to whatever practice management EHR system you're using, and being able to pass patients back and forth seamlessly and appointments so that you don't have to rekey that data. So that's a key part. And we also offer additional integrations, be it with SMS, for example, or email systems, phone systems, whatnot. So a lot of other add-ons, if you will, that we can bring to the table as well. And then the last piece, and you'll get a little bit of flavor of this here shortly, is the analytics part. And that's kind of a huge for most of the practices we work with, is being able to have that real-time data at your fingertips of your leads, your sales, your revenue, and being able to track all of that and have that data available across the whole practice. So that's a quick overview of our offering, and I will now turn it over to Liam.
Thanks, Garrett. So we like to use this image. It's a pretty drastic image, but it does a really good job at kind of explaining what the problem is. So our big message is most practices think that they have a marketing problem, but oftentimes they do not have a marketing problem. We fundamentally believe that the problem is a follow-up problem. We've talked to hundreds and hundreds of practices, and the easy target is always marketing. If you're not doing marketing, if you're not spending any money on marketing right now, then maybe you do have a marketing problem. But most of the practices that we work with are spending a significant amount of money on marketing, and the problem is no one is there to follow up with those leads. So how do we know that? We know that because we have mystery shopped hundreds and hundreds of clinics. So Garrett, if you want to go to the next slide, and more than half did not follow up at all. More than half did not follow up at all. So not a single text, not a single email, not a single call. So all of the work that the marketing company is doing with the ads, generating those leads to come into a system to then actually get followed up with and get on the schedule, no one is reaching out to those. So why does this happen? Why is the follow-up broken? Often it's because the individual at the practice is wearing not just one hat, not just two, but they're wearing multiple hats. They're answering the phone, they're checking in Julie that's coming in, they are training a new member of staff that has just come on board. And oftentimes the thing that gets deprioritized is the follow-up. So that is exactly why we exist, Boost. So what we do is we are the sales arm. We follow up with all of those leads for you guys. Out of the practices that did follow up, and Garrett, if you want to go to the next slide, it is still not that fantastic. On average, this is what we see. We see you may give them a phone call, you may send an email, and typically that email is automated. So it's not even personalized. It will say, hey, thanks for your response. We'll get back to you in 1 or 2 business days. And then maybe you'll get another phone call. This is a lead that you're spending thousands and thousands of dollars on just to call them once, maybe twice. So we believe that the problem is a follow-up problem. So if you want to go to the next slide, Garrett, this is just a visual of what our follow-up looks like. We have AI that's on 24/7, which addresses the speed to lead issue. As soon as someone comes in, you want to be ready to talk to that lead whenever they're ready. And then we have multiple calls, multiple emails, multiple text messages that go out, because you never know what type of lead is coming in. So to Aman's point, there's different demographics depending on kind of what your marketing strategy is. Some prefer phone calls, some prefer emails, and some prefer text messages. You need to make sure you're using all three in your arsenal. Go to the next slide. So we believe there are 6 principles of follow-up. Speed, so speed to lead, you need to be getting back to these leads within 5 minutes at best. We get back to them within 60 seconds, but you want to be getting back to them fast. When they fill out their form, they're probably on the websites, browsing other competitors. So when they fill out a form on your site, make sure you're in there, in the inbox, you're in their text message thread, you want to be getting back to them ASAP. The next thing, we call it joyful persistence, but you want to make sure you never give up. We see over and over again, and I have an example of this in the case study, where a lead will come in, they will not reply for days, for weeks, for months, and it takes sometimes hundreds of days of follow-up to get someone to actually reply and say, you know what, I want to consult. You need the tech to be able to do this. No one human can do the follow-up that we see works effectively, so you need to use AI, you need to use automation, and then you need the right people to kind of oversee that, to manage that. You need the right people on the phones to get people in for those consultations. And then you need to use all 3 channels, text, email, and call. You need to use every single one over and over again, because you just don't know which one is going to resonate with them when they are ready to do so. And then you need organization. You need to make sure you have a system in place that tracks all of the follow-up, that tracks all of the leads, so you know kind of where they are in their journey, so you can then convert them into consults. So I'll leave you with this last slide, which is the average speed to lead we saw is 1.7 days. What if you guys responded in 5 minutes? Do you think you would see more or fewer consultations? Clinics only attempted on average 2.17 follow-ups. Could you have converted more leads if they followed up for a very long time? And then 139 clinics only called or left a voicemail. Do you think if you use text, email, and calls, you could convert more of those leads into consultations? So I would always encourage you, no matter who you're using for follow-up, whether it's Boost, whether it's someone internally, is to always mystery shop yourself frequently, just to see and get a pulse on kind of what's happening. Take care.
Awesome. Thanks, Liam. Next, we're going to turn it over to Dan from ClearSight. Dan?
So thanks, everybody, today. Love seeing some names I know here on the call as well. So ClearSight started in 1994 here in Oklahoma City. We currently have locations in both Oklahoma City and Plano, Texas, and we do all the major refractive procedures from LASIK to lens replacement to premium cataract surgery, as well as EVO, ICL, and SMILE. We do about 3,000 refractive procedures per year currently, and of course, are always looking to grow that in a good way that we can. Is there another next slide there, Garrett?
Yep.
Yeah, perfect. So the quick overview of this, and I'm sure Garrett or others will weigh in on this, is that these 3 groups work together to help us really address social media leads. And we've, as all of you we have tried lots of different ways over the years to figure out how to take the best advantage of social media leads. As we know, social media leads tend to be high funnel. You tend to get, what great is they can have a lower cost per lead, but they also are not quite as engaged as somebody who was referred by another patient, right? And so what I love about all 3 of these groups is that they are experts at what they do, and they're also all very committed and very responsive in working and fine-tuning and working together on this project. So the way it works is Reflexion works to create the content, to run the ads, to track the acquisition cost, to do all those things. Then any leads they generate come into our Salesforce instance, where we can track them and see what's going on. We see exactly how many leads we get each day, what the sources were, what the status of those leads are. But one of the things we figured out was that we didn't have enough staff to properly follow up with all these leads, just as Liam was talking about. And so at the same time that these leads come into Salesforce, they immediately are sent over to Boost, and Boost immediately begins that follow-up process. So when Liam talks about, we can generate a lead within 60 seconds, they're responding to that lead with AI and going down, and then a programmed follow-up sequence. It is what has allowed us to do is take far better advantage of these higher funnel social media leads, and know that we're getting the most out of those. That's the quick overview, Garrett.
Awesome. Thank you, Dan. All right. At this point, RJ, are you taking over?
I think no, I'll take over that.
Keep going. All
Thank
right.
you, Garrett, and thank you, Dan. So one of I think Dan was mentioning that we come in and create content, and the idea of how do we tackle this part where I think Dan mentioned was like social media leads are top of the funnel. So what do we do in terms of making that they can be either middle of the funnel or bottom of the funnel? Well, it comes down to how much content can you get your leads to consume prior to their sales calls and prior to them walking in. In order for that to happen, you have to have variety. So these are 4 creative styles that we use that we can actually create a lot of consumption of content. So on the left, you have Dr. Luke Rebinich right here. We use a green screen method. Specifically for lens-based procedures, this works really well. You can see the engagement on the left-hand side that people are really engaging to that right here. After that, you have AI UGC. I mean, AI implementation is key in your practice right now, and we always hear about it. So user-generated content, but you can actually test it out with artificial intelligence, use different people that you can show different screens in the start. On the right-hand side, you have after that is a talking head. This is more of an educational style content where you have Dr. Luke sitting down and more going into further detail with lens-based procedures, whether ICL, refractive lens exchange. And on the right after that, you have OR footage. This is where we use a lot of our visual hooks is you're showing the actual the procedure itself. So these are 4 very specific creative styles that you can start implementing immediately. The more variety of creative styles that you have, the more content you can get your leads to consume prior to them coming in, the more credible your practice becomes, the more educated your patients are, and it becomes easier for Boost and your in-office your patient counselors to convert your lead when they've consumed different styles of content. Because one patient might relate to a user-generated content, another patient might want to get just educated on specific procedures. So my biggest recommendation is to have variety. The more variety of content styles that you're going to have, the better your leads and the better lead quality is going to be. So there's 2 tips for better conversions. Number 1 tip is RJ always talks about this called seamless content. So if you're running an ad for Facebook, or if you're running an ad on Instagram or running an ad on TikTok, make sure the content that you create is seamless and native to the platform itself. Make an ad that doesn't really look like an ad. So on social media specifically, whenever you're trying to sell or you're making like a commercial, it sounds very salesy. So when you create ads that just are very seamless, and people can't even tell that it's an ad, it works extremely well. And number 2 is the biggest tip that we say. It's what we call moment marketing at Reflection. We sell the outcome, not the product. There is always an aha moment within the practice, whether it's a conversation between a surgeon and a patient, whether it's them reacting to right after they get a vision correction procedure done. You really want to capture these aha moments because they're organic, they feel authentic, they feel like, oh my God, it's like, this is an amazing, I would want to feel that way as well. You're selling the end outcome of vision correction. You're not trying to sell them on anything. So if there's 2 tips for creating content and creating these ads, it's, make sure that whatever content that you create feels real, authentic, and it doesn't feel like you're trying to sell them anything. So this is what I think I dabbled into this a little bit. It's called hook testing. Like I said, 80% of your users will fall off after the first 3 seconds. On the left-hand side over here, we use this, the monitor, the TV screen and an eyeball as a visual hook. The reason why we know that is because you don't really see eyeballs, when you're scrolling through your Instagram. So if someone sees that, they're most likely going to be disrupted and stop. And you really want to do that because, at social media, you're scrolling so fast. And if you don't create disruptive content, it's going to be very hard for you to get a lower cost per lead and get them in the funnel. On the right-hand side over here is what we call a audio hook is want to get out of contact glasses. That's an audio hook. You can change that. Every person that's going to be wearing contact glasses will stop and say like, okay, what do these people have to say? So you want to test out your visual and audio hooks, and make sure that the first 3 seconds of your videos you're constantly just reiterating, your visual hooks and your audio hooks, to see what works. So this is just hook testing examples. Like there's one video, but we're like, okay, which hook, whether it's bad vision, high prescription, looking into vision correction, not a LASIK candidate. So the great thing about social media ads specifically is that you get data, your attribution cycle is between 7 to 10 days. So every 7 to 10 days, you can get data really fast to make creative changes extremely fast. This was never possible on any other medium other than social media. And that's the beauty of it, is that we test out different hooks, whether it's visuals or audios, extremely fast, and you can make reiterations really fast, and you can continue to actually lower your cost per lead. And if whatever marketing agency you use, if they aren't creative testing like this, if they aren't hook testing, if they aren't giving you new hooks to use, hey, this worked, this didn't work, this is getting a higher cost per lead, this is getting a lower cost per lead. So you want to continuously test out your hooks, whether it's visual or audio. And this is how we do it. And we saw like, hey, if we test out enough hooks, we can literally we can lower the cost per lead by 30 to 50% if there's enough hook testing. This is what we call an audio hook database. So for example, if one of our practices says, hey, we want to focus on a just modern vision correction, don't worry about it. Don't go procedure specific. We'll start off with something like, hey, want to get out of contact glasses, or tired of waking up and reaching for your glasses. But if you want to go narrowed, you want to talk about ICLs, or you want to talk about a specific refractive lens exchange or clear lens exchange, we'll go with something like, hey, have you been told you're not a LASIK candidate? Right? Or have you heard about an LASIK alternative? So it's basically as narrow as you get. When you go procedure specific, you can be as narrow as you want to be, and that's the beauty about it, that you can actually, more importantly, you can, if there's a specific procedure that you're looking to grow or scale, you want to make sure that all the audio hooks that you're using are very specific to that procedure itself. Lastly, this is very, very important in terms of the resistance. So if they're consuming your content and if you allow them to submit a form very, very quickly, that's not really resistance. So the more questions you ask on a lead form, the more resistance you're creating. Meta has a great lead form that you can use now. The more questions you put on, we actually average between 5 to 7 questions on our lead forms. And then we add a 2-factor authentication to make sure that every lead that's coming in is a real lead. Because on Meta specifically, I think all of us have faced this, that sometimes there's a lot of bots that are just flooding in. So what Meta did is added a 2FA to actually make sure that every lead that is submitting a form is actually a real lead. And you can play around with this, whether you want to ask 3 questions or 7 questions, depending on how much resistance you want. And you can actually track that, hey, if you add 5 questions or 7 questions, your CPO might not even jump that high, and you get a higher resistance and higher quality lead as well. And once that lead is submitted, it goes to Salesforce, and Dextara takes over, make sure that we have good data tracking set up on the back end, so we know how to make creative changes, lead form changes. And it's very, very important to get a feedback loop going. And that's why when we work with Boost, when we work with Dextara, it's constant feedback. Hey, this is what your lead quality is looking like. Change this. This is what we're hearing on the phones. This is what the data is saying. So we can actually make creative changes, lead form changes extremely fast when you have the proper feedback loop happening.
Perfect. Thank you, Aman. So let me pick it up here. So as that form gets submitted, we immediately push that into Salesforce. And in Salesforce, we do 2 things. We create what we call a prospect record, kind of just a brief summary of name, email, phone number. But as part of that, we also include here up in the upper part of information about the lead itself. Okay, so you can see here, for example, we assign a status, right, of that lead. We correlate the source, in this case coming from Facebook. And then we also are noting specifically, not only did this come from Reflexion, but it's related to ICL. And then we also are noting hey, what's the next step? What's that follow-up step from a lead gen? And in this case, we hand it off to Boost, right? And so the nice thing about collecting and noting those attributes on the lead is that we then have that available for reporting purposes as we continue to work these leads. Okay. Um, Second piece that we do once that lead comes into Salesforce is we create what's called an opportunity. Okay. And think of an opportunity in Salesforce as kind of the equivalent of a situation where you're trying to sell them something, right? I know a lot of you guys don't like to use the word sales, but in essence, what you're trying to do. In this case, it's a specific type of opportunity. We call it a consult opportunity because the whole purpose here is you are trying to get them in the door for that initial exam, right? And so that's the whole purpose of creating this record is for your team Boost to track those interactions and have a place where you can keep track of all of that together. And so that's in the bottom part here. And so just a couple of notes on there is you can see we're noting the type of lead this is. It's around ICL. We're also noting that it originated from Reflection there. And then the other thing we're doing in that note section is actually displaying the data that was collected off of that form from Facebook in this case, right? And so that we have that for reference as we move forward. Okay. The other thing to note here is as this status changes, in particular as they get scheduled, for example, or if they cancel, or if it actually gets completed, we're pushing those updates back to both Reflection and Boost so that they can keep track within their respective systems of where this lead is at, right? And so that if they've gotten scheduled, they know that they can Boost, in Boost's case, they can stop the follow-up process, right? So very important for all of us to be tied together and be aware of kind of where each other is in the process, okay? The other last thing to note here is that when this lead does get converted to a patient, we carry over all of these attributes. Okay, so it's being able to take those forward and again from a reporting standpoint, utilize those. All right. So the next piece here is then kind of our second part is, as all of you know, once that initial exam's completed, and that person is a candidate for some kind of a surgical procedure, we create a second opportunity in Salesforce to track that. And we call it a procedure opportunity in this case. Looks similar, a little bit, some nuances on it. But bottom line is it's a way to track the progress of the actual surgery itself. Okay. And so again, you can see on here, we're noting what type of surgery this is. And again, we see carry forward that it originated from Reflection, right? So that we can have that to report on. Very similar to what we do with the exams, we also, as a procedure is scheduled, completed, canceled, we push those updates back to Reflection and Boost as well so that they have that information available to them. All right. From there, I'll pass it on to you, Liam.
Okay, thanks, Garrett. So I have three examples to show you of conversations that actually happened inside of the ClearSight account. But just before I do that, I'm going to talk about kind of how we have these conversations. So we have AI, like we mentioned, which a lot of you are probably hearing about. AI is the buzzword right now. We need more AI. We need more AI. We need more AI. We fundamentally believe you do need that, but you need to know the exact pain point that AI is solving. So we use it for the speed to lead, so being ready and available whenever that lead on the other side of the texting line is ready to communicate. We have that there to do so. And then we have what we call our patient concierge agents. So these are actual human beings that work at Boost that are calling all of the leads and monitoring these conversations kind of as they come in. And that is the most important part because we try to get every single lead on the phone to get them to book. Because like Aman said, we want to create some resistance. we call it friction in that booking process to make sure that those leads actually do turn up and actually come in for that consultation. So we work with practices and we build out custom knowledge bases, which are unique to each practice that we then train our AI on and that we train our patient concierge agents on to be able to do the thing that we do best, which is follow up with those leads and get them scheduled. So this first example, if you want to click to the next slide, is a new lead came in. We initiated it with a text, a couple texts and an email, and then they did not reply to any of that. Within 10 minutes, our patient concierge agents has called this lead, had a near a 7-minute conversation, and got them scheduled for a consultation. So oftentimes, follow up, if you don't have a system in place, is invisible. You don't know what's happening. You do not know what's happening with your lead. You may have Julie at the front desk sending an email. You may be calling the lead from your desk phone, but there is no central repository to see what is actually happening with that lead, which is one of the values that we bring at Boost. Is you see every single thing that we do with that lead in one screen. That's one example. If you want to go to the next slide. This example shows you the value of AI. This lead came in at 11 p.m. So they interacted with one of the reflection forms at 11 p.m., which we see happen a ton. I would say over 50% of leads come in outside of business hours. So having a system in place to be able to get those leads' attention is incredibly important. So if you want to go to the next one. Here you can see they come in at 11. Lead immediately replies, yes. We start that conversation talking about Evo ICL. I'm going to go through to the next page. Having a conversation here, quick conversation at 11 p.m. in the evening, going back and forth, back and forth. The messages that we have, again, are tailored based on that knowledge base, and you see all of this inside of our system. And then if you want to go through to the next slide, what you'll see here is the lead said, yes, I do want a consult. They said yes at 11. They did not schedule that consult. So our team called that lead the next morning, had a 7-minute conversation with them again, got that lead on the schedule. So again, it shows you the power of AI to capture that lead's attention so they don't go to another website, so they don't go to another competitor site to fill out that form. But it also shows you the incredible power of human being actually calling that lead, then get them on the schedule. And then the last example I have is probably my favorite, and we will not go through every single one of this conversation, but we call this joyful persistence. This is a fantastic example of a lead that came in, engaged a little bit, but then stopped. 126 days later, we got them on the phone and scheduled them for a consultation. So Garrett, if you want to click on that and bring up that PDF, I have a visual here to show you, just so you can see kind of the effort that goes in, which again is typically invisible if you don't have a system in place, but we make it visible so you can see kind of the work that goes in. So Garrett, if you just want to scroll through, you'll see all of the texts, all of the calls, all of the emails that we're sending. And this lead came in January, and then 126 days later is when that lead converted to a consultation for ClearSight. So there's many, many messages. So you can see missed calls, text messages being sent, emails being sent, another missed call where they don't pick up. If you keep scrolling, you'll see eventually this lead does start to engage again. And this follow-up is there. Our follow-up is tailored as well based on how they interact. If we do get them on the phone and they say, hey, you know what? Thanks for the call. I just need a little more time. They don't get all of this follow-up. They get tailored follow-up based on kind of where they are in their journey. But if they don't respond to anything, then we have joyful persistence. So here you can see in April, yes, I would. We get great. We send them the scheduling link. Nothing happens. So we call them the next day. We call them the next day. We keep doing this until they call us. So they call the texting line. We pick up. We book them for a consult.
Awesome. Very great example there. All right. Thank you,
Garrett, if you allow
Liam.
me,
Dan?
I wanted to add something real quick on that one.
Oh, sure.
So yeah, so it's a 1-2 hit, right? You're creating content on social media for 126 days. So you took them from top of the funnel, you're making them consume content. Boost is reaching out, following up. They're consuming content, follow up, consuming content, follow up. So if you want to take someone from top of the funnel, it's keep continuing to create more content, more variations, and have variety of follow up go in. And both is required for a patient to schedule a consultation.
Very good. All right, Dan, back to you to kind of touch on some of the analytics.
Yeah, no, absolutely. So, like I said earlier, what I love about this group is that we have all the pieces. We have the creativity we need, the persistence in trying and testing creativity with reflection. We have on the opposite end with Liam and Kate and their team. I love the phrase joyful persistence. And you have this great combination of both AI and human agents that are tailored and customized to your practice with your knowledge base, with your pricing, with your whatever it is you want to have the answers to. The AI and the humans can give those answers at times when your staff can't be available or just don't have the staff to work on this volume of leads. But what you're seeing here, of course, is the middle part with the CRM and with Salesforce, where we can do the tracking. So, on the left, we have leads by week. Right now, we're generating over 250 leads per week. Reflection is generating for us on this. Boost is typically getting, overall over time, they've gotten around 15% of those leads to book an appointment at some point, which we love. And then you can see also recent weeks here where the percentage of our booked appointments at the top right by location that are paid social or other. Just I wanted to see what are we getting out of this, for the investment we're putting in, and you can see we're generating quite a few new booked appointments for this. And then further on, we of course develop reports that track this back to revenue, that track it by month, or we can look at it by the date the lead came in, the date the exam was booked, the date they had the procedure. That's the beauty of Salesforce. If there's some question you want to get answered, there's a way to answer it. So that's the quick overview of the analytics.
Awesome. Thank you, Dan. Appreciate that. That concludes our content that we got. And at this point, we're ready to take any questions. So let me figure out how do I look at that. Sorry, guys. Let's see here. Where's the chat? Here we go. All right. I am not seeing any questions. Is there anything in particular from folks that you might be interested
While you
in?
give that a minute there, Garrett, I do want to ask Liam a question. So, what I liked about the examples you gave was you could see how the AI was giving good detailed answers with, even at 11 o'clock at night, right? It was able to provide high quality information, which is difficult to create and to do. So I just want to highlight that and appreciate that. And then the fact that then your team, kind of petered out, they went to bed, but then your team followed it up the next morning. I thought that was really, really good.
Yeah. Yeah. It is crazy to see how many leads actively are engaging kind of at those crazy hours. Even early in the morning, we see it over and over again of actual conversations, solid conversations happening at hours when, the staff has gone home and gone to bed.
Yeah, another I'm gonna chime in right here. Another good reason to have AI in my like what you guys do, Liam, is like I believe the statistics like 40% of all leads that we generate are gonna come in after hours. And so like, that's something that you just can't control. Maybe you can control it on the media buying side on the ads. You can turn off the campaigns to run from a specific time in the middle of the night if you're not trying to capture those leads. But regardless, if your practice closes at 5 p.m., a lead can come in at 5:05 if someone's on the office. There needs to be someone to be able to attend to that lead. So that's what I do like. I actually have a question. This is, I think there's a couple questions in the Q&A. So Garrett, you want to take that?
Yeah. So Dr. Ling, what's the current market benchmark for conversion leads to consult from each social media platform?
What's the current market benchmark for conversion leads to consult or from each social media platform? Mon, you want to take that?
Yeah, I'll take that. So the benchmark can vary from procedure to procedure. If you're running a vision correction only, we always like to be at that 15%. The 15 to 20% is what we want to be at. We've seen months 22%, and sometimes it goes down to 12, 13%. And then we're like, hey, what do we have to fix in our process in order for be able to hit that 15 to 20% mark, which is great if you think about it from a cost per booked appointment perspective. we can get our CPLs down very, very low, or sometimes under $10, but we actually range between 10 to 20, depending on what procedure we're looking to promote. But I think that's the benchmark that you want to set, that you always need to be at least at a 15% lead to book. It's extremely important.
Aman, kind of touch though, real quick, because there seems to be multiple questions around that same thing. How each source is going to be different, right? Social media is going to be different than Google. Google is going to be different than your YouTube, and kind of touch on that and as to why each platform is different based on intent.
Yeah, and it's kind of, I mean, I think Liam put it really well, like it made it very, very simple. That lead came in 126 days ago, right? And clearly that was a top of the funnel lead. It just required it, like we say, the marketing boils down to how much content you can get your lead to consume. So some leads are going to take 4 months of content consumption, follow up, further information, further research, and they're going to go down the funnel. We have a lot of times where a lead comes in 3, 4 months ago and it's converted after 3 months. So Google leads, of course, it's the bottom of the barrel, right? And if you keep fighting for bottom of the barrel leads, then it's just everybody's fighting for that 20% of leads. But what's going to happen is that we see a big shift where when you're running social media ads, you get a lot of traffic on your website, because what's going to happen after you scroll on Instagram at 7 p.m. or 9 p.m.? You're going to go to a website. You're going to go do your research on ChatGPT. That's why we're really, really big on, we've shifted a lot of our focus onto YouTube and getting ranked on ChatGPT, because that's where the long form content is. So Meta, TikTok, Instagram, yes, short form content. But YouTube, ChatGPT, that's where the long form content, that's where more information comes in, specifically for lens-based procedures. If you want to grow that, you want to make sure you're creating long form content and short form content, because that's what you do further down the funnel. That's where people actually get educated. That's where the hard questions are being answered. So from a curiosity perspective, Meta, TikTok, Instagram is great. From an educational perspective, YouTube, SEO, getting your website right. That's where the traffic actually ends up. And, so that's the thing. We see a lot of traffic going, it's called omni-channel now, one channel to another, to one platform to another. And you want to be everywhere. And that's what actually, in today's market, that's exactly what it takes.
So
Yeah,
Aman, we
I
have
don't. I would just to add to that. I was going to say,
okay.
I don't see it as is it a Facebook or is it a Google? Where do I put my money? It's like Aman said, you should be doing everything. We see it kind of within our system when the leads come in. We may get a lead that comes from Reflection. They then retake an ad that comes from Google. So it's not one or the other. It's everything.
So
And let me add on
Aman,
to that real quick. Sorry about that. Social media, when you look at social media, you have to understand it's people are not there to be sold anything. They're there to scroll, see their friends, see some memes, have fun, right? So idea is you can create all the awareness in the world on your social media platform, especially with variety of content. You can educate them. But once they opt in, you want to make sure that, that's why Boost does a great job of making sure that the right follow-up is set up. Because we put in all this effort creating all this variety of content. But if the follow-up is not there, if you aren't furthering their education down the funnel, then your conversion rates are going to suffer.
so Aman, a follow-up question around the lead conversion to consult. Savannah's asking about the actual conversion to surgery. Any stats around
Yeah.
that part of it?
Yeah. So, in-office conversions, if you are a very heavy clear lens exchange practice, the way ClearSight is, they do a fantastic job in terms of in-office conversions, right? So there's multiple variables we track, and we want to look at cost per lead, lead to book percentages, book to show percentages, show to in-office conversion. So the four main KPIs that you want to be tracking is where are the gaps? So Reflection, yes, we create a lot of content and we do a lot of social media ads, but we're really, really actively involved with, is it a lead to book problem? Is it a book to show problem? Is it a show to convert problem? So, whether you're a practice, you're going to be your numbers are going to be low, either one of these four KPIs. They're not going to be in your benchmark. And you want to make sure that you set a benchmark and then you focus on the actual problem in hand, whether it's a marketing problem or a sales problem or in-office conversion problem, whether your patient counselors are not performing well, whether it's whether we have to optimize certain things with Boost that, hey, can you just start tackling the price objection or the pain objection even better. Why don't you want to add? We help Boost add video links to their follow-up process. So if you're creating videos, use those videos in your follow-up. You'll decrease your no-show percentage. So you don't want to just see video as top of the funnel. You want to use video in every part of your funnel, all the way to the point where they sit in your chair. So that's the beauty of video marketing, that so much legwork can be done when you get them to consume more and more content.
Yeah,
I'm going to
and
do
if you have marketing teams already, I would encourage you to get everyone to work together like we do here on this call. It's incredibly helpful for everyone, and especially the practice.
So I'm going to do
And
a quick shout out to Troy Cole. To Aman's point, a lot of this is how your counselors are engaging and following up. Once the exam's been completed, Troy definitely is your guy to consult with and get assistance on that. He's very good at that, and encourage you to connect with him. Liam, there was a question
I want to
also
add one
about.
last thing. I want to add
Oh,
one
sure.
last thing. It's a very, very important point. Yeah. And I want to shout out Troy as well. If your in-office conversions are hurting and your patient counselors, sales is a very, very, it's a very up and down situation, because it's human beings and we're going through a range of emotions, and, we're never going to be consistently, the graph never goes up. So you want to make sure, specifically someone like Troy is in there who's training your counselors to stay consistent. Because there's so much effort going from a marketing, from Boost to follow up, from Dextara to track every little thing happening. But even if one piece is missing, the patient has a bad experience, and it just ruins everything. So making sure you're consistent all the way, like Liam said, all the way through the board, and all your teams are working in alignment, is extremely important.
Perfect. Liam, there was a question there around your team.
Mhm.
Do you want to address that?
Yeah, so the Boost outpatient concierge agents they're all based in Mexico, and most of them once upon a time actually lived in the United States and then have now moved over to Mexico. So they are fantastic. If you're here on this webinar, we will mystery shop you guys, and I believe in our mystery shop, we do actually have some recordings of our agents, so you can actually hear them. And then the system that we use to kind of track everything is Go High Level. And we've created an API with Open API to actually create our AI that goes back and forth with your leads.
Nice. All right. Another question that was actually submitted previously was, what percentage of our marketing budget should go towards lead generation? I think that's a big question
Mhm.
people are asking themselves, how much should I be spending on this? Aman, Liam, Dan?
So we probably spend about a quarter of our budget on social media. Every practice is different. You have to tailor it to your market. We probably spend about 40 to 50% on mass media, about a quarter on social media, about another quarter on pay-per-click. And we kind of view that as, we're trying, the mass media, of course, is reaching a certain audience. Social media is reaching them on a deeper level with different messaging, more flexible messaging, testing, and they can respond directly to generate leads, right? Versus mass media is more branding. And then, but finally, of course, pay-per-click, we are trying to capture, when somebody does have intent and they want to finally look for what you're offering, you're hoping that they'll seen you on social media and heard you in your mass media and click on you first in that pay-per-click. So that's our strategy.
To answer that question, my strategy is to get more and more money from Dan to give to me to add on my budget. So that's my strategy. Budgets are very, very important in terms of, look, there's a certain amount of awareness that needs to be created. There's a certain amount of bottom of the funnel leads that need to be catered to, and a certain mass media that needs to be given out. So you want to allocate your budget based on your practice, this is a very important point. Do not increase your budgets unless your sales funnel is sorted. Because what you're going to do is you're going to amplify the problem. You're going to make your in-office counselor, your patient counselor stressed out. If you don't have a good call team, if they can't handle 300 leads, they sure as hell can't handle 500. So a lot of times they apply pressure to us, push the lead volume, but make sure before you push your lead volume, you know your lead to book, you know your no-show percentages, you know in-office conversion. So there's actually a pivoting point. I call it the tipping point, where your sales team won't be able to manage a certain amount of volume. So your budgets have to be directly aligned with what your team can actually manage. Because if you apply too much pressure, your lead to books will drop, your no-show percentage will increase, your in-office conversion will decrease. So as you incrementally increase your budget, make sure everything is aligned accordingly.
Great point, Aman. So, last question. We're getting about out of time here. Dr. Ling has a follow-up around balancing self-scheduling versus via counselors, call center, following up. Liam, you want to take that?
Well, let me just see what that was. What was the follow-up? Sure, yeah. So we believe you should have the self-scheduling option on the website because you're gonna have leads that come at different ends of the funnel, like Amanda's been saying. So you want to make sure you don't create resistance and friction for those leads who are ready, who are hot right now. You don't want to have them fill out a form to speak to us, to get on the phone to us, to then get on the schedule. If someone's ready, let them schedule, and then you kind of monitor that with a team like this in place to see, okay, how many no-shows are happening? Do we need to tweak that? Do we need to add some resistance and friction into that booking process? Like maybe, require a credit card, require a deposit. So that's how I say you should balance. You should definitely have both, but it's not something that you set and forget. It's something you set and you continually monitor to see how that's impacting kind of the no-show rate and you guys kind of there at the practice.
Perfect. All right, we are at time. So just to conclude, as I think most of you know, that when you registered, part of our offer to you and Liam and Boost is going to kind of take the lead on this is for everybody who's attended, we are going to mystery shop you, and then we'll follow up. That process, Liam, roughly 3 to 4 weeks. Is that correct?
Yeah, it's going to be around 3 to 4 weeks. As long as we have your name, your email, and the practice that you guys are with, or at least the website you want us to mystery shop, we will do that. So if we don't have that after this, we will reach out to the email that we have and just say, hey, thanks for attending the webinar. If you would just let us know the website or the practice you want us to mystery shop, we'll go ahead and do that.
Perfect. All right. Thanks, everybody. Appreciate everyone's time and the questions, and let us know how we can help. Everybody have a good day.
Thank you, guys.
Thanks,
Thank
guys.
you, guys.
Yeah, ready.
Bye-bye.
Take care. Bye.